Ladies and gentlemen, please welcome Dr. Richard Payne, the John B. Francis Chair at the Center for Practical Bioethics, and Myra Christopher, the Kathleen M. Foley Chair at the Center for Practical Bioethics.
Good evening. Richard and I have the honor tonight of presenting the 2015 Vision to Action Award. But before we do so, I think we need to thank those people that you just saw on the video. They are volunteers who advise and guide us at the center. We refer to them as our citizen leaders. Most of you are in the room. Would you please stand? Thank you, thank you. Thank you very much. Tonight we're going to honor two outstanding women, Dr. Noreen Clark and Dr. Kathleen M. Foley, with the Center's Vision to Action Award. Regrettably, the award to be presented to Dr. Clark will be presented to her posthumously. Noreen was an amazing woman that Richard and I both had the opportunity to work with when she was co-chair of the Institute of Medicine committee that published Relieving Pain in America.
Yes. Each year since 1993, the center has presented one or more people with the Vision to Action Award. Those who receive this recognition believe in the center's vision of a world in which ethical discourse and action advance the health and dignity of all people, and who have directly been involved with the center's work. In honor of these recipients, the center provides scholarships to the Berkeley Symposium,
which will be tomorrow. We'll talk more about that later. Dr. Clark was director of the Center for Managing Chronic Diseases at the University of Michigan, and prior to that, she had served as the Dean of Public Health. Ironically, she was born in Scotland and immigrated to the United States as a child, but I know of no person who was a bigger advocate for health and the well-being of Americans than was Noreen Clark. She served on many national committees, work groups, and in 2000 was elected to the Institute of Medicine, which we learned today has changed its name to the National Academies of Medicine. But we were thrilled, as I said earlier, and privileged to have the opportunity to work beneath her and Dr. Phil Piso, who co-chaired the Committee on Chronic Pain. As the center decided, as a consequence of working on that report, to create a national alliance to advance the recommendations that have been made in that report, we call the alliance PAINS for shorthand. I often called Noreen and asked her for her help. Every time we talked, she said this very same thing at the end. She would always say, "What you're doing is important. Thank you for trying to move the recommendations and the report forward." And then she would always say, "Let me know what I can do to help." And she was true to that. We were very, very grateful for her help with that.
I can affirm everything Myra has said about Noreen in our work with the committee. She is sorely missed by many.
You know, Richard, we had hoped that George Pitt, Noreen's husband, would be able to be with us. He was very pleased that we had made the decision to honor her. Unfortunately, his health has precluded him from being here. But I want to quote, before we begin to talk about Kathy, something that Martin Filbert, the current dean of the School of Public Health at the University of Michigan, said about her. He said at actually her memorial event that it is a rare thing indeed that any one person can fulfill with grace and kindness the role of a scholar, a mentor, a sage, a teacher, a confidant, a colleague, and a friend. And that was so true. I wish she could be with us tonight.
Yeah.
But we're thrilled to have Kathy with us.
We are absolutely thrilled to have Kathy with us. And it's now my honor to introduce you to Kathleen M. Foley, whom we are honoring tonight. Before I do so, you should know that Myra and I had to kind of arm wrestle with each other here to decide who was going to get the honor of introducing Kathy, because after all, Myra holds the Foley Chair at the center. But you may know that Myra recently had shoulder surgery, so I won out there. And
But next year I'll win.
I get to introduce Kathy. Kathleen Foley has been my teacher, mentor, friend, and colleague, actually for more than 35 years. She is a pioneering neurologist who retired from Memorial Sloan Kettering just earlier this month or last month.
This month.
And where she founded, actually, the Pain and Palliative Care service. She is truly an institution in and of herself at Sloan Kettering. I was a student of Kathy's as a neurology resident, and Kathy, as I recall this, you may recall differently, but as I recall this, I was sitting in the nurse's station writing notes on a patient, and I'm such a dinosaur, in those days we still wrote our notes by hand, and I was writing my note, and I kind of had this sense that there was someone standing in back of me, and I looked, and it was Kathy and Dr. Jerome Posner, the chair of our department, and they said, Rich, I think you should come and be a fellow in the pain program and neuro-oncology program. And for me, it was like the hand of God reaching out to select me. Now, of course, I had to say yes. I could not say no, and I have to say that it was truly the wisest decision of my career. Kathy's research and advocacy for improved pain and palliative care has truly, this is not an exaggeration, has led to better care of people throughout the entire world because of her work and her effort. She has also been a stalwart supporter of the Center for Practical Bioethics, and it is my pleasure at this time to present this award, the Vision to Action Award, to my teacher, my mentor, and my friend, Dr. Kathleen Foley.
Oh, well, thank you. The good news is I'm not going to sing. Thank you, Richard. Thank you, Myra, and all those involved in making the decision to recognize me with this award tonight. I want to give a special tribute to Noreen Clark, who I also knew well, for her incredibly tireless work to lead the IOM committee in so many of its deliberations, its controversies, and to produce the Relieving Pain in America report, because IOM reports are so important to a field as it's trying to emerge in both advocacy and policy. I want to thank Professor Wallou for his remarks this evening and for publishing really a challenging book on pain as political history. I commend it to you all as a really realistic commentary on the war and pain, and I think he needs to write another book on the war on pain and the war on drugs. In my academic role, I've had the honor to work with Rich, as you've heard, smart decision, right, in developing approaches to improve the care of cancer patients with pain. In my other role as a funder, in my efforts to improve end-of-life care both nationally and internationally, which have been supported by the Open Society Foundations, I've had the opportunity to both advocate for and support Myra and the center's efforts in end-of-life care, both from the policy perspective and Richard's efforts to improve end-of-life care for African Americans. Their leadership over the years on these incredibly challenging issues have made a real difference. And the center's current work in supporting the PAINS project is, I think, just the kind of leadership model we need to be sure that the voices of the vulnerable are heard and respected. I think the center's work is a shining example of creating dialogue and discourse on important public health issues that impact vulnerable population, like the dying, like those in pain, for whom there is little priority for these issues in our country. Awards like this should humble all of us, and me particularly, because I have the privilege of caring for the dying and caring for the patients in pain. These patients deserve, as I think you saw from the video, the recognition and respect that their quality of life, that their pain relief is of paramount importance and should be so much better recognized in healthcare policy and in healthcare systems. I really look forward to the center's work in addressing the National Pain Strategy and providing what I think is so necessary, the moral and the intellectual force to improve care for those in pain. I also look forward to tomorrow to the symposium where we're going to have the opportunity to debate these challenges in the politics of pain. So again, thank you very much. Thank you for the work of the center. It's critically important, so thank you all for being here tonight and for supporting the center.
Thank you, Kathy. I mean, she's such a wonderful resource for the whole world, for us. Earlier this evening, John Carney introduced you to the center's program, PAINS. PAINS is a coalition of national leaders and organizations committed to transforming the way pain is perceived, judged, and treated. PAIN's steering committee is a who's who among advocates like Kathy and others who are committed to advancing recommendations made in the Institute of Medicine report and incorporated into the National Pain Strategy report recently posted through the Federal Registrar. The center has been deeply involved in this national movement and in both of these historic reports. Lynn Webster, a pain specialist and researcher at Utah, and past president of the American Academy of Pain Medicine, and a member of the Pain Steering Committee, is with us tonight to share a preview of a landmark documentary that will be aired actually on PBS this fall.
Dr. Webster is completely committed to this issue, so much so that he has written a book about 9 patients that he has cared for and produced a documentary based on it. Both are titled The Painful Truth. The people he talks about, one is a mom who loses her daughter and is critically wounded in a random shopping mall shooting. An NFL player, a teenager, and 6 others who struggle day after day, like those you saw in our video, to live with this dreadful condition. And to talk about those who care for them. Both Dr. Webster and Dr. Welu have said the capacity of physicians who care for those with chronic pain has been so compromised and constrained by law enforcement and regulatory agencies that many who live with this dreadful condition struggle to get the care they need and the care that their physicians want to provide for them. It is true that the suicide rate for those who live with chronic pain is at least 2.5 times that of the general population. And unfortunately, the younger the person is who lives with chronic pain, the more likely he or she is to commit suicide because they feel they have no other way out. Dr. Webster and the producer of the film crisscrossed this country for more than a year, talking to people like those you saw in the video, talking with healthcare professionals, people like Kathy Foley and Richard Payne. They also talked to legal authorities, law enforcement agents, patients, people on farms, people in the workplace, people in retirement communities, and people huddled together in support groups. In the video, they explore the human emotions, the conditions, the impact on families, and the subject of opioids, which is a complicating factor in all of this. But they also present some pockets of hope in the medical world where people are really working hard to make things better. We are honored and thrilled to be able to show to you for the very first time